Your body communicates important signals when there is a significant issue at hand. Identifying these signs can significantly impact outcomes. Today, we will discuss 7 physical symptoms that must never be overlooked. These are critical indicators that professionals advise necessitate prompt medical attention. Immediate action, no delays. This is not intended to instill fear. Rather, it is focused on ensuring your safety. Numerous older individuals often delay seeking assistance, believing their issues are trivial or feeling reluctant to inconvenience others. However, timely intervention can prevent a small concern from escalating into a significant crisis. More crucially, being aware of what to observe empowers you to take charge of your health. In this video, you will discover the 7 warning signs in your body that medical professionals highlight. It is imperative that you refrain from these should not be dismissed as unclear symptoms. These indicators are precise, tangible, and often urgent. Remain with us until the conclusion, as one of these signs could potentially safeguard your life or the life of a loved one. Let us begin. One sign, such as slurred speech or facial drooping, indicates a specific set of symptoms that healthcare professionals are trained to recognize immediately. These symptoms point to a medical emergency that requires urgent attention: stroke. Should you experience sudden difficulty in speaking, with your words appearing garbled or slurred, or if you observe that one side of your face is not moving as it should, it is imperative to seek immediate medical attention. The same urgency applies if you find yourself unable to lift one arm, or if it drifts downward when you attempt to raise it. These symptoms are not to be ignored. They may indicate a serious issue with your brain that requires prompt intervention. A medical professional once stated that for every minute a stroke remains untreated, approximately 2 million brain cells are lost. Time encompasses more than just financial value. It embodies memories, communication, actions, and the essence of life itself. This is a fundamental truth that many individuals, particularly seniors, may not fully grasp. Strokes can occur unexpectedly. You might be enjoying a typical day, reading the newspaper, watching television, or having lunch, and then suddenly find that your speech is not flowing as it should or that your smile appears uneven. These subtle changes may seem unusual but not alarming, which is what renders them particularly perilous. In the case of a stroke, prompt treatment significantly enhances the likelihood of recovery. Please take Robert, a 68-year-old Vietnam veteran, was enjoying his morning coffee when he suddenly dropped the cup from his right hand. Confused, he called out to his wife, but his words came out incorrectly. She quickly noticed his crooked smile and immediately called 911. Robert received treatment within an hour and made a remarkable recovery. Had she not acted swiftly, I might be in a wheelchair or worse, he later shared. The medical community employs an acronym to help individuals recognize a stroke, emphasizing the importance of each component. However, the aspect that often gets overlooked is the final letter, which signifies that every minute is crucial. If there is slurred speech, facial asymmetry, or sudden weakness, do not take a nap. Do not wait for an appointment. Call emergency services immediately and seek assistance, as prompt action can preserve your ability to walk, talk, remember, and live independently when facing a brain-related issue. Indicate 2 abrupt sensations of constriction or discomfort in the chest. One of the most pressing indicators your body may present is an abrupt, unexplained discomfort or pressure in the chest. This sensation might manifest as tightness, squeezing, or even a burning feeling, potentially radiating to the arms, shoulders, neck, or jaw. While some individuals may attempt to rationalize it as mere heartburn or anxiety, the truth is that this could signify a serious issue requiring immediate attention. In older adults, this situation is particularly perilous as the symptoms of a heart attack can be understated, gradual, or entirely different from what one might anticipate. A cardiologist once shared the number of patients who arrived too late because they thought it was indigestion. It's heartbreaking. If there's even a chance it's cardiac, get checked. That statement holds a lot of truth, especially when you consider that many heart attacks in seniors don't come with the crushing pain we see on television. Sometimes it's a dull ache, a fluttering feeling, or just a sense that something isn't quite right. You may feel dizzy, short of breath, or suddenly exhausted even without physical activity. These aren't things to monitor, they're things to act on. Helen, a 74-year-old retired school teacher, experienced an unusual tightness in her chest one afternoon while reading a book. Although it wasn't severe, the sensation persisted. I thought maybe it was gas, she mentioned, but something urged me to call my daughter. Her daughter quickly arrived and insisted they go to the hospital. Helen experienced a mild cardiac event. Fortunately, she received prompt treatment and achieved a complete recovery. If I had waited, I might not be here, she said. Now, I pay attention to my body for the first time. That's the lesson here. When your body is in distress, it doesn't always scream, it often whispers. With a condition as critical as heart issues, those subtle indications can serve as a crucial alert. Do not delay until you find yourself incapacitated or struggling to breathe. If you encounter chest discomfort that is unusual, persistent, or associated with other symptoms, do not hesitate. Seek medical attention promptly. If you are still watching this video and find these insights helpful, please comment number 2 below to let me know you were present. If you haven't subscribed yet, I encourage you to do so and activate the notification bell to stay updated on our latest videos. Your support is invaluable in helping us produce informative and inspiring content. Let's proceed to discuss 3 instances of shortness of breath at rest. It's important to distinguish between the sensation of recovering your breath after physical activity, such as climbing stairs, and the experience of feeling breathless while at rest. Experiencing sudden shortness of breath while engaged in quiet activities such as reading on the couch, watching TV, or lying in bed should not be taken lightly. This symptom, particularly when it occurs without any significant physical exertion, may indicate serious underlying health issues that warrant further investigation. Pneumonia or a pulmonary embolism, which involves a blood clot in the lungs, necessitate immediate medical intervention. A respiratory specialist once remarked that if breathing becomes challenging without an obvious cause, it signals that the body is sounding an alarm. It's not merely a result of aging or tiredness, it's a plea for assistance. That assertion, it is particularly relevant for older individuals that as we age, our lung capacity tends to diminish and our heart must exert more effort to circulate oxygen-rich blood throughout the body. However, the distinction between a typical aspect of aging and a potential medical emergency lies in the suddenness of its onset and the intensity of the symptoms. If you find yourself experiencing significant shortness of breath after a brief walk, or if you wake up feeling unable to breathe properly, it is crucial to recognize that something may be amiss, potentially involving your lungs, your heart, or both. Delaying attention could lead to exacerbated symptoms or irreversible harm. Consider the case of Walter, a 76-year-old retired electrician. He had always maintained decent health, but one evening while watching his favorite show, he experienced an alarming sensation of breathlessness. There was no accompanying chest pain, fever, or physical exertion, just an overwhelming feeling of not being able to get enough air. His daughter urged him to seek medical attention, and at the hospital they discovered a small blood clot in his lung. Walter reflected, "If I had waited until morning, I might not have woken up." The key takeaway here is that shortness of breath should not be dismissed or monitored for later. It demands immediate attention, particularly when it arises suddenly, worsens rapidly, or makes even the simplest tasks feel exhausting. Trust your instincts. Your body often signals when something is amiss, even if the cause is unclear. If you find yourself struggling to breathe for no apparent reason, do not hesitate to go to the emergency room. It is far better to determine that it was nothing serious than to discover too late that it was a critical issue. Signs of unusual confusion or sudden disorientation in a senior can manifest as sudden forgetfulness of familiar things or a lack of awareness regarding their location or the time. While it may be tempting to attribute these changes to aging, such rapid onset of mental fog, particularly when it is uncharacteristic, serves as a significant warning sign. It may indicate a serious condition such as a stroke, a brain infection, dangerously low oxygen levels, or a severe reaction to medication. Each of these scenarios necessitates immediate medical intervention. A hospitalist once noted that in older adults, the brain frequently serves as the first organ to indicate distress. Sudden confusion acts as the body's emergency signal. This insight is particularly crucial as many seniors and their families may overlook confusion as a mere sign of fatigue or a bad day. However, when changes occur abruptly, such as forgetting names, becoming disoriented in familiar surroundings, or communicating in nonsensical ways, it is imperative to take these signs seriously. These are not gradual memory changes, they represent sudden shifts that often point to more significant underlying issues. Linda, an 80-year-old woman, lived independently and managed her own affairs. One morning, her neighbor discovered her standing in the hallway of their building, appearing disoriented and unsure of how she had arrived there, fully dressed yet visibly startled. She kept repeating the same question. Her family speculated that dehydration or fatigue might be the cause, but upon taking her to the hospital, she was diagnosed with a urinary tract infection that had led to a sudden onset of delirium. After receiving antibiotics and fluids, she returned to her normal self within a few days. "I didn't know confusion could stem from something like that," her daughter remarked. "Now I'll never forget." Disregard it. This is precisely the outcome we aim for. The brain is delicate, and in older adults, it frequently reacts to other issues such as infections, oxygen deprivation, or fluctuations in blood sugar before anything else does. Therefore, when confusion appears unexpectedly, do not wait for it to resolve on its own. It may, but if it does not or if it deteriorates, the repercussions can be permanent. If you are still watching this video and find these insights beneficial, please comment number 4 below to indicate your presence. If you haven't subscribed yet, I encourage you to do so and activate the notification bell to ensure you don't miss any videos. Your support enables us to keep producing valuable content to inform and inspire you. Now, let us proceed. Indicate 5 instances of intense or abrupt abdominal discomfort. It is common for individuals to experience discomfort occasionally, particularly as they age. However, when the pain is sharp, sudden, or intensifying rapidly, especially in the abdominal region, it warrants immediate attention. Severe abdominal pain may indicate a serious medical condition such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, such pain can also suggest a blocked intestine or a ruptured organ, both of which can pose significant risks if not addressed promptly. A trauma specialist has noted that when an elderly patient reports sudden abdominal pain, it is treated with utmost seriousness, as timely intervention can be crucial in distinguishing between a manageable issue and a potentially fatal one. This understanding is vital as older individuals face a higher risk of complications. Classic signs of illness may not always manifest in the expected manner. You might not experience a fever or noticeable swelling. You could simply feel unwell or suddenly double over in pain. Regardless, your body is signaling that something is amiss, and it is crucial to heed those signals. Consider the case of Frank, a 72-year-old widower who took pride in his resilience. One evening, while finishing dinner, he experienced a sharp pain in his lower abdomen. Assuming it was merely gas, he took some antacids and went to bed. By morning, the pain had intensified, leaving him too weak to stand. His daughter called for an ambulance, and the emergency team discovered a twisted section of his intestine that had compromised blood flow. Emergency surgery ultimately saved his life. He thought it would simply pass. Frank later mentioned that he was unaware of how quickly situations can deteriorate. This narrative is not unusual. Older adults frequently minimize their discomfort or hesitate to seek help, hoping for improvement. However, when experiencing sharp, persistent pain that feels different from anything previously encountered, it is crucial to seek medical attention rather than endure it. Exercising caution carries no risk, but delaying action could have serious consequences. If you experience severe abdominal pain that persists, particularly if accompanied by nausea, it is essential to consult a healthcare professional. If you are experiencing vomiting or dizziness, it is important not to make assumptions or search for answers online. Seek medical attention if you have persistent vomiting or notice blood in your vomit. Occasional vomiting may be due to spoiled food or a stomach virus, which can be uncomfortable but typically resolves on its own. However, when vomiting lasts for several hours or includes blood, it escalates from a minor issue to a significant health concern that requires professional evaluation. Continuous vomiting can result in significant dehydration, electrolyte imbalances, and potential kidney complications. Additionally, the presence of blood in vomit, regardless of the quantity, is concerning. It is crucial to recognize the potential severity of symptoms such as internal bleeding, which can manifest as bleeding in the stomach, a torn esophagus, or ruptured ulcers. A gastrointestinal specialist has emphasized that the presence of blood and vomit is never a normal occurrence. This symptom is one of the quickest indicators of internal bleeding in older adults, and it should serve as a serious warning. Unfortunately, some individuals may dismiss or misinterpret these signs, which can lead to dire consequences. The blood may present as bright red or resemble dark, grainy coffee grounds. In either case, it indicates a potential issue within the digestive tract. For older adults, this could be a response to medications such as anti-inflammatories, a complication from an undiagnosed condition, or even damage to the stomach lining related to stress. Please take this into account. Evelyn, a 79-year-old woman, had been using over-the-counter pain relievers for her arthritis. One evening, she began vomiting after dinner. Initially, she suspected the shrimp, but upon noticing dark flecks in the sink, which she thought were remnants of old food, her grandson urged her to seek medical assistance. At the hospital, doctors diagnosed her with a bleeding ulcer that had been developing silently for months. "I had no idea it was that serious," she confessed. "If I hadn't gone in, I might not have lasted another day." This serves as a crucial reminder of the importance of addressing health concerns promptly. Vomiting blood is a serious condition that requires immediate attention. It is not something to dismiss or manage with home remedies. It indicates that there is a significant issue within your body that needs to be addressed. Whether it stems from a damaged stomach, liver complications, or a burst blood vessel, only prompt medical evaluation can identify the cause and prevent further complications. If you find this information helpful, please comment number 6 below to let me know you're engaged. If you haven't subscribed yet, I encourage you to do so and activate notifications to stay updated on our content. Your support is vital for us to continue providing valuable insights. Now, let's proceed with the discussion. A high fever accompanied by a stiff neck and sensitivity to light can indicate that your body is combating an infection. However, if the fever is particularly high and is accompanied by symptoms such as a stiff neck, headaches, confusion, or difficulty with bright lights, it may suggest meningitis, a serious inflammation of the protective membranes surrounding the brain and spinal cord. While meningitis is more prevalent in younger individuals, it can certainly impact older adults, particularly those with compromised immune systems or existing health conditions. When it occurs, it can progress rapidly, necessitating immediate medical attention. A medical professional once stated that if an elderly patient presents with a fever and exhibits an inability to flex their neck or tolerate light, we take immediate action. The level of urgency present here is quite significant and conveys a great deal. By the time these symptoms manifest, the infection may already be well established. The stiffness in the neck is not merely discomfort, it is an indication that the protective lining around the brain is inflamed. The sensitivity to light is not just bothersome, it signals that the central nervous system is under distress. For some individuals, this may also be accompanied by nausea, vomiting, or an overwhelming sensation of pressure in the head. None of these symptoms should be trivialized as just a common illness. Consider the case of Jerry, a 75-year-old widower and avid crossword enthusiast. One morning, he found himself unable to complete his daily puzzle due to a severe headache. By the afternoon, the pain in his neck was so intense that he could not look down, and the light from his kitchen window became intolerable. Fortunately, his neighbor, a retired nurse, recognized the warning signs and promptly took him to the hospital, where doctors diagnosed bacterial meningitis. Thanks to swift medical intervention, Jerry was able to recover. I initially believed I was merely fatigued. However, it was later revealed that the situation was far more serious than I had anticipated. This underscores the importance of recognizing the body's warning signs, such as a fever. A stiff neck and light sensitivity are not to be taken lightly. These symptoms indicate a potential threat to your nervous system. In cases like meningitis, timely intervention is crucial. Every hour matters. Effective treatment options are available and they yield the best results when initiated promptly. Do not hesitate if you or a loved one exhibits these symptoms. Do not wait for an appointment or attempt to rest it off. Seek immediate care at the emergency room and allow the experts to handle the situation. Prioritizing your health is crucial, and waiting could pose a risk that is not worth taking. It is crucial to recognize the signals your body communicates, particularly as we age. The 7 signs are not intended to instill fear, rather, they are designed to empower you. Understanding when to take action reflects wisdom, not weakness. This wisdom, gained from years of experience, underscores the importance of treating your health with urgency rather than delay. It can be tempting to dismiss symptoms thinking you will be fine or that it is likely nothing serious. However, many individuals shared stories today where timely action made all the difference, whether it was making a phone call or going to the hospital. Those decisive moments were pivotal. The distinction is crucial, and it's essential to recognize that prioritizing your well-being extends beyond personal benefit. It impacts your family, friends, and those who cherish your presence. Each day you maintain your health is a day they can appreciate your insights, experiences, and affection. Therefore, regard your health as the invaluable treasure it truly is. We appreciate your participation today and invite you to share your reflections in the comments below. Let us know one takeaway from today and how you intend to incorporate it into your life. Your perspectives matter, so please feel free to express them. Your feedback provides us with significant motivation and encouragement. If you found this video enjoyable and helpful, we kindly ask you to like, subscribe, and share. Your support is essential for us to keep producing quality content that informs and inspires. Thank you for watching, and we eagerly anticipate your presence in our next video.